Well, it's very important to develop a vaccine. The head of the CDC has just said that they expect this epidemic to last for at least a year, so a vaccine would be very helpful. And it used to take a decade or more to develop a vaccine because you needed to grow the viruses in culture and then work with them from there. But now that we can genetically sequence the viruses, we can do these DNA and RNA immunizations, which work much faster.
What do you make of what we heard about the plasma blood, the plea for plasma as a possible solution? How effective is plasma, and how widespread can it be? I mean, how much can one person's donation, how many people can it help, for example?
Well, this is a very well-recognized technique to protect against diseases and treat diseases. It was used both in the SARS epidemic as well as in the Ebola epidemic, because someone who has survived an infection has antibodies against the infection. And giving plasma is a little bit different from giving blood. Giving blood, you know, they take off a little bit and you're done in an hour or two. In plasma, you often have to sit for several hours while they filter your whole blood and take some of the plasma out. And usually one donation can treat several people, but they'll need to really ramp up the number of donations that they receive.
And this falls under immunotherapy, which is really a trend in lots of areas of health now.
Yes, including cancer, absolutely, yes.
As a health expert, how effective would you say that China's quarantine policy has been? Its shutdown of Wuhan, and even now reports, for example, in Beijing, that people are being forced to quarantine if they're coming home for 2 weeks.
We know that the number of infected is increasing. And so it's hard to say whether or not these measures have been effective. We'll probably know over the next couple months whether we see the epidemic still ramping up or whether we see it leveling off. I mean, one kind of, wrench in all of this is that they changed the definition of what a case is in Wuhan, that they're making a clinical diagnosis as opposed to a lab diagnosis. So they may be diagnosing people as having coronavirus who don't actually have it.
I was going to ask you that. We had a surge in reported cases because they changed the definition. What was the change and how did it affect the numbers?
So before, they were only reporting people with lab-diagnosed coronavirus.
Confirmations with the kit.
Exactly, with the kit. But because there's a shortage of the kits, because it takes too long, they're now just using what's called a clinical diagnosis, sometimes looking at x-rays, sometimes just based on the physical exam. And so as a result, they're reporting many more numbers. And I think it was a reasonable change to make.
Do you expect all of this to get worse before it gets better? I mean, we did have Donald Trump mentioning that in April, when the weather gets better, this could all go away. What are your expectations?
I expect to see a lot more infections. I mean, it's very concerning what's going on in Vietnam. They've had to quarantine a whole, community of 10,000 people because that's where half of their coronavirus infections have come from. It's good that the government has taken those measures, but it is very concerning. We also now have our first case in Africa, which is very concerning as well.
We're here in the U.S. Does the average person outside of China, outside of Asia, even have cause to worry here, in your opinion?
I think there's no reason to worry in North America or Europe. I think we have very robust public health systems. There's only absolutely essential travel now between the U.S. and China. They're quarantining people returning, and several of them who've returned have been diagnosed as positive.